Good afternoon,
Hey
Senator.
Chris, how are you?
Good. How are you today, sir?
Alrighty, it's okay with you. I haven't mastered the ability to speak to these things very well.
That's no problem, sir. Thank you for taking the time. First, I want to ask, with many people struggling with the coronavirus, having lost jobs, some places have closed, people possibly facing eviction, what is being done at the Senate level to help them right now?
Well, not enough. And I think everybody knows Mitch McConnell made it clear. Just told us the other day, he does not want to go forward with a significant piece of legislation. So you have millions of people who have lost their jobs, they've lost their income. These are people who are struggling to put food on the table, struggling to make sure they're not evicted from their apartments, struggling to make sure they have health care for their kids. And you have the leader, Republican leader of the Senate saying, no, we're not going to do anything because he has 20 United States senators who are not prepared to vote another dime to help working families in this country. That is an outrage. And that is not only why we've got to elect Biden as president, we need a Democratic Senate.
Now, healthcare has become a hot button topic, and it continues to evolve. Now, healthcare helped Pittsburgh and the Western Pennsylvania region rebound after the collapse of steel, some of that being private insurance. What is the future hold for private insurance as healthcare evolves?
Well, you know, Joe Biden and I have different views. I happen to believe in a Medicare for all single payer program. I think healthcare is a human right. It's not a privilege. I think it's a bit absurd that we are spending twice as much per person on healthcare as do the people of any other country, and yet 90 million Americans are uninsured or underinsured. I also think it is disgraceful beyond belief that in some cases we are paying 10 times more for prescription drugs than our neighbors in Canada. And we've got to have the courage to take on the pharmaceutical industry and lower prescription drug costs in this country. Now, Joe and I have different paths to the goal of universal health care. But I do know that what Joe wants to do is expand health care to cover all Americans. He wants to lower the very high cost of health care, and he is prepared to take on the drug companies and lower the cost of prescription drugs.
Can expansion happen with
I'm
private? Can expansion happen with private insurers being part of that picture?
There are different approaches. Joe has his approach. I have my approach. My approach would be in year one to lower the eligibility age for Medicare from 65 down to 55 and to cover all of the kids in America. Joe has a different approach.
Now this week begins the Senate hearings for Coney Barrett. What is that going to look like, Senator?
Well, I think we know what it's going to look like. The Republicans have the vote, and they are going to appoint her to be a U.S. Supreme Court Justice. And I think what people should understand is when you have a right-wing control over the Supreme Court, and she will just give another vote to the right wing, it means that programs like the Affordable Care Act are under attack and may be ruled unconstitutional, which I think is absurd. That will mean some 23 million Americans losing their health care. It means that a woman's right to control her own body is under attack. It means that voting rights, that states that want to go forward and make it easier for people to vote are going to have all kinds of problems doing that with this Supreme Court. And you have her, if people may have noticed, she was asked a question, rather unbelievable to me. She was asked the question, what do you think about the constitutionality of Social Security? Duh. We've only had Social Security in America for 85 years. Think about a Supreme Court that says, oh, we think that Social Security and Medicare are unconstitutional. That is totally absurd. But when you have a very right-wing Supreme Court, those are the kinds of challenges that we're going to be looking at.
Something that has come up is the term court packing. If Vice President Biden is elected, is that something the Senate would look at?
Well, I think what Joe said is a pretty good idea. I think people want to, I think there is unhappiness with a Supreme Court that is so political. You got a political U.S. House, you got a political U.S. Senate. We're elected. And I think people want more from a Supreme Court. They want the justices to be looking at the constitutionality, the legality of various pieces of legislation, not voting in a political way. And I think what Joe Biden has suggested is that we take a hard look at that. And I agree. I think that's a reasonable approach.
Real quick, Senator, why is Pennsylvania so important to this election that you are even here today?
Well, you got a whole lot of electoral votes, and the president won the state by just a relatively small number. And we think that it is absolutely imperative that we have the largest voter turnout that we possibly can, that working people stand up and say, you know, enough is enough. We need a government that does not just represent billionaires. We don't need more tax breaks for billionaires. What we need is to make sure that all of our people have health care. We lower the cost of prescription drugs. We raise the minimum wage. That's what Joe Biden is about.
And how do you change? In 2016, went to the president. How do you make sure it doesn't go to the president this time?
You do exactly what people today are doing. They're knocking on doors, they're handing out leaflets, they're doing everything they can to get their aunts and their uncles and their co-workers and their fellow students out to vote. And I would just say to people in Pennsylvania or Vermont or any place in America, this is the most important election, not only in our lifetimes, but in the modern history of this country.
Thank you, guys. Senator, thank you for your time. I appreciate it.
Thank you.
All right, Senator, 2 more to go.